Let's do it. All right, Dr. 𝗙𝗏, first statement for you, myth or fact? If I go to a hospital, I will get COVID. Myth or fact?
Myth.
Please explain.
Well, we covered this a little bit earlier. With the level of concern that everybody has in the hospital right now for contracting it themselves and the fear of spreading it to other patients, we're taking the utmost precautions with PPE, hand washing, social distancing. And there's 6-foot tape mark lines around every possible facility in the hospital that keeps people 6 feet from each other. So the hospital, as Dr. Schmitz mentioned, is one of the safest places you can be right now. So yes, you can go seek medical care if you need it at a hospital.
Thank you. Here we go. Dr. Schmitz, next statement. Vulnerable people are not people like me. They're people like my parents or my grandparents. Myth or fact?
False. We are all vulnerable, and we can't predict individually who's going to get this and who's not. There are some things associated with higher risk, but we're all potentially vulnerable.
All right, here we go. Dr. 𝗙𝗏, I like this one. No, I'll take this one. Hey, why don't I join in the fun? I like this one. I'm going down this list. All right, here's a statement, myth or fact. I know the answer because this applies to me. Here's a statement. I should continue to delay my routine health checkups with my physicians. The answer to that is a big fat myth. We want you to continue your healthcare checkups, continue to invest in your health. I am worried, just like how Dr. Schmitz and Dr. 𝗙𝗏 are, that of us having delayed some access to care, certain things like mammograms, colonoscopies, things like that, diabetes follow-ups, that's going to actually cause a really big public health threat and more disease burden as we go down the door. So that's a myth. Here we go. Dr. 𝗙𝗏, I like this statement. It is easy for me to get a test to see if I am currently infected with COVID-19, even if I do not exhibit symptoms. Is it easy to get a test?
That is a fact. Oh, is it easy? No, it's a myth. Sorry. It depends on where you live, but it's not easy to get a test. If you're asymptomatic, it is not easy to get a test in all locations.
Wonderful, thank you.
By your location.
Thank you. Here we go, Dr. Schmitz. I like this one. My town has minimal cases of COVID-19 and no deaths. Therefore, I shouldn't have to worry about the virus affecting my community.
Myth, because it probably just hasn't gotten to the surge yet, and also we haven't tested enough to know where it is in the community. So that's definitely a myth.
Wonderful. And I may expand and say, again, we still continue to be an interconnected society. People still travel, people still work, they still go visit. We cross city lines, county lines, et cetera, et cetera. So this is certainly, the risk is still there. Here we go. Dr. 𝗙𝗏, I like this one. It is not clear to what extent children help spread the virus. Myth or fact?
That's fact. It is not clear exactly what role children play in spreading this particular virus. But they do, it's well known they do play a big role in spreading other viruses. So you could extrapolate and say it is likely that they could play a role. One of the reasons why obviously schools have been canceled, but we don't know for sure.
All right, here we go. Dr. Schmitz, I like this one. We kind of answered it, but let's ask it again just to hit home the point. There will be fewer cases of COVID-19 in the summer. Myth or fact?
I don't think we know yet. I think that is what a lot of people are hoping, but I don't think we have good evidence to say that yet, and I guess we'll find out in the next few months.
Yeah, we will. Thank you. Here you go, Dr. 𝗙𝗏, I like this one.
I'm hoping for a fact on that one.
Yeah, there you go. Here you go, Dr. 𝗙𝗏, statement, myth or fact. The idea of controlled voluntary infection akin to the chickenpox parties of the 1980s is a good idea. Myth or fact?
That's a myth. That's a terrible idea.
Please explain.
I'll leave it at that.
I mean, it's a bad idea.
For something so virulent and so much, it's just a much higher risk of having complications and deaths than chickenpox. Chickenpox is bad for adults. Yes, it's mild in children. Yes, coronavirus is mild in children, but those children go out and can infect other folks. So the more folks that are exposed to this virus, the more people that are at risk who are trying to do their best to stay away from it are going to be at risk. So, like I say, it's a selfish thing to expose yourself and not think about the greater whole of society.
Yeah, I always say that you don't know if your body's going to be in that percentage of people, the majority, where it's
Absolutely.
Like they're not going to get anything, or because we've all seen young people that have no issues in the hospitals, and you're the one that's you're the one, Dr. 𝗙𝗏, or even Dr. Schmitz from your end, you guys are the ones that are intubating them if they're coming in acute. All right, here we go. Dr. Schmitz will do 2 more of these. I like this one. Dr. Schmitz, we will see a spike in COVID-19 cases during the 2021 influenza season.
So I think we probably will. We tend to see an uptick in viral infections and spread during the winter months. A lot of that is people sneezing, coughing, touching, spreading things. And the data initially looked like it was unlikely that you could have two things at once, but the most recent papers that are coming out are showing as much as a 20% co-infection with different viruses. So once it's out there and as the weather changes, we'll see, but I think we will see a second surge.
All right, thank you. Here we go. Last one, Dr. Carrick, I like this one. Here's a statement. There are existing drugs that will prevent, treat, and cure COVID-19 infection. Myth or fact?
Currently, that is a myth. We don't know for sure if any of these drugs work well. We've heard a lot of early speculation that some of these will work. We now have some data that some of the early drugs that we thought might be effective may in fact are not effective or may in fact be putting people at risk. There's several hundreds, literally, of trials going on right now to try to find medications that are effective. We have some drugs that have shown in vitro activity, meaning in a lab or petri dish, have the potential to be effective. We currently don't have data that those work in vivo or in humans. So currently, there's no good indication to use these antiviral drugs or immunomodulatory drugs for treating COVID infection or trying to prevent it outside of a clinical trial.
All right, thank you, Dr. Carrick. There you go. There's myths versus facts, everybody. All right, guys, so we have about 5 minutes left, and this has been an awesome discussion.